Hi, I'm back with another video, and this one is relating to my nursing school supply haul, kind of. This will be the first part of it. I'm sure I'll collect more supplies before the semester starts in January, but I've already gotten so many, I figured I'd go ahead and film what I have. Most of my school supply haul is books because I had to purchase over like 10 books, I think, for the semester. Some of them will be used throughout nursing school, but others I need for just the semester, I'm sure. My books were estimated to cost over $1,900 from my student store, but luckily I went through Amazon, and so far I've ended up spending under $800. And this video is not sponsored by Amazon, of course. I just use Amazon, and I do have Prime, and it's one of the best investments I've ever made. Most of these were at least $50 cheaper on Amazon than they were at my student store on campus, so I would definitely recommend looking around before making your purchases. But if you are going to order from Amazon and the book's not offered with Prime, I would definitely order well in advance just to give it time to get here through UPS shipping and stuff, because I am still waiting on one that's estimated to be here, I think, Monday the 5th, which is fine. It's well in advance. But yeah, I'll get into my school supplies, and I'll start with my books. The first book I'm going to show you guys is the Nursing Drug Handbook 2017. My actual supply list only asked for the 2016 one, but when I went on Amazon it showed me that there was a more updated one. So I figured, why not get the most up-to-date one? I'm going to be using it for multiple years, and I'm sure the information is obviously valid and will be for a couple years. This book is pretty much as the title says, Saunders drug book. It shows like different drugs and their interactions and things to look out for. And I'm trying to remember how much this one was. I can't remember how much it was off the top of my head, but I'll link it in the description bar, or like note how much each book was in case you guys are interested. The next one in my stack is the Mosby's Manual of Diagnostic and Laboratory Tests, the 5th edition. This book, I don't even know. Let's look at it. I've barely opened this. This book contains a lot on procedure and indications and normal findings and patient care and all that types of stuff. So this just basically tells you about diagnostic and lab tests that you may have to run as a nurse and how to interpret them and what they mean. And again, I'll link the price in the description bar. Okay. And then I have the Nursing Diagnosis Handbook, which is by I don't know how to say the word. I'll show you. It's by this person, people, company, whichever. Let's see. This book is just on like risk factors for different types of conditions and diseases. Let's see. So this is the Nursing Diagnosis Handbook, and this handbook is for diagnosing, obviously. There's also printable critical care thinking care plans online that you can use that go along with this book, so I'll definitely be taking a look at those. And if I find those to be useful, I'll include that in a video, of course. And after I get into the semester, I'll probably also make another video on like more detailed of what I use the books for and how the online care plan works and things like that. My next book is called Calculate with Confidence, and I think this is a practice book. They recommend it for us because every semester we have a dosage test where we have to calculate how much medicine each person gets on, like, in certain situations, like if it's an adult or a child or an older person and things like that. So this would definitely be good because I want to start practicing early, like over winter break, on calculating, just because we have the test so often and I want to be as prepared as I can. Next, I have my Clinical Nursing Skills and Techniques book, which is still in the plastic wrap. I'm going to go ahead and take that off now. And the only thing I wasn't a big fan of about this book is that it is paperback, but paperback was slightly cheaper, and let's see. This book is on supporting the patient through the healthcare system, vital signs, infection control, dressings and wound care, nutrition, things like that. And I think this is one of the more expensive books, which is probably why the paperback one came up on Amazon versus the hardcover. And while I do wish it was hardcover, I don't think that it being paperback will be the end of the world. I'll just have to be a little more careful with it. Then next I have my pathophysiology book, and I've heard this is one of the more challenging classes. It's called Pathophysiology, Introductory Concepts and Clinical Perspectives by Teresa Capriati and Joan Parker Frizzell, I think. And it does come with the access code that we need for our class. And yep, this is my patho book. Next is my physical examination and health assessment lab manual. This one came with, oh, this is like a workbook that goes along with the textbook, which is the, what's this? Which is the Jarvis Physical Examination and Health Assessment textbook. This one is hardback. And this is on evidence-based assessment techniques, and physical examination, putting it all together. Lots of details. But yeah, this is my physical examination book. And another book I had to get was for my fundamentals class, and it's called Fundamentals of Nursing. And I know a lot of YouTubers or nursing videos show like the white and purple and blue cover, but this is the updated edition. This is the 9th edition, which is the one they recommended we get. So it's still by the same people, Perry, Potter, Stalker, and Hall. And it's about like caring through the lifespan, professional standards, foundations, all things that have to do with the fundamentals. This is what it looks like. And last but not least, for the textbooks I have right now, this one is my biggest one by far, and I'm dreading having to take it with me to the library, but you gotta do what you gotta do. This is my medical surgical nursing book. It's this wide. I don't know if you can really tell how wide that is through camera, but this is a big book. And it's very heavy. As you can see, medical surgical nursing. It's about med-surg. It talks about problems, nursing care in critical settings, concepts, pathophysiologic mechanisms of disease. I'm just reading all these out of the table of contents from this book. But yeah, this is a huge book, and I'm sure I'll be using this one throughout my career, throughout my classes and everything like that. So that's what this one looks like. Okay, that's it for my textbook. So now